Consent is all about respecting each person's autonomy and boundaries and ensuring that everybody who is participating is willing and enthusiastic. So as I mentioned just there, consent needs to be enthusiastic, right? Meaning it's not like a, I guess so, or if you really have to. Enthusiastic, a yes.
Hey everybody, before we start the show, I want to make a couple disclaimers. This show does cover a wide variety of topics related to mental health and life in general, and some of those could be sensitive for you. I want to simultaneously encourage you to be brave in consuming difficult content, but also respect and recognize your limitations. So please use your best judgment. I will never be offended if you need to skip a question or an episode entirely, but feel free to feel it out, check out the episode, and just see what happens. If you need to skip, that's okay, but feel free to give it a shot first. I also need to say that while I am a psychologist, I'm not your psychologist, and I'm not your therapist. This is not intended to be direct medical advice, and you should not use this as a substitute for professional help. So with those said, let's go ahead and get into the show.
All right. Hello, friends of all varieties. This is the Hardcore Self-Help Podcast, episode 347. I'm your host, Dr. Robert Duff, aka Duff the Psych. I make mental health content for real people just like you. And today I have a question and answer episode. I have two really awesome questions from listeners like yourselves. Before I get into them, I want to give a bit of a content warning. So the second question, which will be, during the second half of the podcast, involves some discussion of violated consent, sexual assault, things like that. No nitty gritty details, but it certainly talks about it plainly. So just want to give you a heads up about that one. But so two great questions from listeners like yourselves. If you would like to send me a question for the show, please shoot me an email to duffthepsych@gmail.com. And I am happy to report that the website, duffthepsych.com, is back up and running. So shout out to my wife who's been working hard on getting that figured out. It is back up. It is a little limited at the moment. We're basically, this is sort of like the minimum viable website. So the podcast episodes are up there and any blog posts moving forward will be up there. But there's a bunch of old stuff that we've had to basically reconstruct, literally going to the Wayback Machine where they have an internet archive, and we're going to have to sort of redo a bunch of stuff that was on the website before, which is annoying, but we'll work on it. So some older stuff will take some time, but all the new stuff will be on there. So if you want to find the show notes for an episode, just do duffthepsych.com/episode, whatever, episode 347 in this case. So that's back up there. You can find the blog posts. You can find information about my books and other projects. You can find the contact info and all of that, duffthepsych.com. I also want to mention that I'm having a very strange day. I got caught in this horrendous traffic this morning that made my commute take 40 minutes longer than I thought it was going to. And then as I was sitting down to record this, there was a yellow jacket, a bee stuck in my office window. So stuck in the space between the two window panes, and it was trying to climb out the top. But every time it would climb out the top, into the office, it would fall back down. And so I was trying to swat it. And every time I was getting ready to swat, it would fall back down. And so I'm like, am I going to have to record with this thing staring at me, just waiting to kill me at any moment? Not literally, I'm not allergic or anything, but it's just buzzing in my window. And finally, after 15 minutes, it finally crawled out enough for me to smack it, and it dropped somewhere, but I can't find the body. So if at some point I scream, it's because it's actually still alive and it's come back to exact revenge upon me. Hopefully not, though. Oh, gosh. Anyway, I hope you guys are doing well. Let's go ahead and jump into it. Here is the first question. It reads, Dear Dr. Duff, I have always been a bit more concerned than the average person with avoiding some things that I consider gross or dangerous. For example, I avoid putting clothes that have been outside of my house on my bed because of the risk of bed bugs, or eating raw leafy greens because of the risk of E. coli. These precautions have never caused me any struggles in my professional life, but they've interfered with my ability to have romantic relationships, yet never to the point that I felt the need for professional help. However, I've internalized COVID safety protocols, and with them being lifted everywhere, I'm now finding myself stuck at home and unable to go to work or social events, or even to maintain friendships with people who accept greater risk than I find acceptable for myself. I'm wondering if there would be a therapeutic approach that could help me. Right now, the only thing I can imagine is that a therapist would try to talk me into giving up wearing a mask so that I can fit in with people. But I already know that I wouldn't keep seeing someone who thinks that is a proper solution. Sorry there isn't a clear question in here, but hopefully this is a topic you can discuss. So I think that there's some questions in here, or there's at least some stuff we can dig into. So thank you for it. What I'm gathering here, just from what you've written, is that you're somebody who maybe has always had some quirks when it comes to the possibility of contamination, but you've been able to work around them. When I say contamination, I mean things like things that you find gross or potentially dirty, the possibility of germs, bacteria, things of that sort. So you've had these quirks for maybe forever, quite a long time, but they haven't caused you enough trouble in your life that you have wanted to get treatment for them. You've basically been able to work around them. So in your private life, basically you're able to engage in certain avoidant behaviors so you don't feel like you're putting yourself at risk of things like bed bugs or E. coli. But in relationships, it's been a barrier. So romantic relationships, you're probably running into situations where maybe they think certain things are unusual, or they don't want to sort of subscribe to the same safety precautions that you do, things of that sort. But now what you're seeing is an uptick in the intensity and the impact of these behaviors because of, COVID-19 protocols, meaning masking, trying to have distance from people, hand washing or sanitizing, et cetera, et cetera. So, I talk frequently about the fact that how one of the defining characteristics of something being a mental health disorder, meaning something that's diagnosable, is disruption in your life. So disruption in relationships or work or health. And from what you're saying, I think you could very well fall into this category. I think that COVID-19 certainly makes it a messier picture because there are some things that are appropriate to do, to be careful about that. But even prior to that, it sounds like you were engaging in plenty of behaviors to mitigate the possibility of contamination or getting germs or, dirtiness. So I think that, with COVID-19, many people have had difficulty reintegrating into the, quote, post-pandemic world. I'm putting that in big air quotes because, the pandemic isn't gone by any means. We've just decided that we are not willing to, continue living in the way that we were before. And, in a lot of places, numbers are down, but it doesn't mean that it's gone, right? So there's a lot of murkiness here. But I would ask, for yourself, is there a reason for the heightened concern that you have, meaning heightened compared to other people? Because you're totally well within your rights to want to protect other people by masking or to avoid potential, COVID-19 infections in yourself, right? So, this is something where there is a degree of reasonable caution that could be taken, but it could also be that this is something where your contamination fears are just latching onto it. And because the fact that there are some rational things that you could do, given the pandemic, it's very easy to sort of get those mixed up and rationalize behaviors that are actually not rational, if that makes sense, right? So in reality, maybe it is a contamination fear, but because of the pandemic, it's an easy sort of scapegoat to rationalize. That's what I'm trying to say. Now, I'm not going to try to diagnose you here, but I am concerned that you could have something like what we call contamination OCD, which is sort of a subset of obsessive compulsive disorder, or a very similar condition, which would be contamination phobia, and that these things have been exacerbated, made worse by the pandemic. You mentioned that you can imagine a therapist telling you just give up wearing a mask so that you can fit in with people. And I can understand the fear there. Basically that's kind of what a lot of society is telling you, right? You feel like you're getting pressured to just like stop wearing a mask so you don't look like a weirdo hanging out with other people, even though that in itself, I think, is an assumption. Like, I think it's pretty normal for people to continue wearing masks at this point, and I don't think a lot of people care about that. But certainly, there are other types of things like being in crowds, going to, eat out, things like that have become much, much, much more normalized. But I don't think that just a therapist saying, hey, take off your mask and go be a normal person would be a likely response, at least from good therapists. I would suggest thinking about, as I said, the kind of OCD frame. There's a form of therapy for OCD, which is called exposure and response prevention, or ERP. And what you have is, with OCD, you typically have these compulsive behaviors, meaning repetitive things, sometimes rituals like washing rituals, or avoidant behaviors. And that is very much like, avoiding the things that you talked about in your question, avoiding bringing clothes into the house, etc. And these behaviors are basically used to try to reduce the stress caused by the fear that you have of being exposed to some sort of contamination. And I would call these sort of triggers, right? You have triggers that are things that you would feel very uncomfortable around. So being in the presence of somebody who's sneezing, that would be maybe a trigger for you. Or having, someone walk into your house and start touching your things without washing their hands, whatever. So these are triggers or, potential triggers. And what the approach of ERP, exposure and response prevention, does is it helps you build up a tolerance to that. But it's not typically an approach that uses flooding, meaning you're not just thrown into the deep end and asked to endure just the most difficult triggers that you can. So instead, a gradual approach is used. So that means that an ERP therapist wouldn't say, hey, throw away your mask and, go have fun, go be like everybody else. That's not something that they would likely do. Instead, they would have a more gradual approach where they would say, okay, let's talk about what your fears are. Let's talk about sort of the different levels of intensity here, and you would probably make a hierarchy together. There's a big difference between taking off your mask and going to Target and maybe sitting in your bed in clothes that you wore outside for 10 minutes or something like that, right? So you can come up with a strategy for building some tolerance to that and trying to show yourself that, you're not going to be in imminent danger by inviting some of these things that feel risky to you. And then there's also the cognitive side of things, meaning the thinking side of it, which I will get into really quick here after a quick word from our sponsor. Okay, this episode is brought to you by MindBloom. Very pleased to say that MindBloom is a returning sponsor, and they're going to be with us for a while here. And I'm happy because they are a great treatment. A lot of you guys out there struggle with things like anxiety and depression. For a lot of you, that's why you listen to the show. And you know that I am all about options, different things that you can do to address anxiety and depression, because sometimes it's a very sticky issue. Sometimes you do the things that people tell you to do. It doesn't seem to do anything. Or your depression is so bad that you can't do those things that people tell you to do. Sometimes you try medication and it just doesn't seem to be doing the trick. So luckily, there's a new tool to help you improve your mental health, and that is at-home ketamine therapy. MindBloom is the leader in at-home ketamine therapy. They've safely helped thousands of people overcome their anxiety and depression. Unlike traditional talk therapy or even medications that build up over time, ketamine works very quickly and it doesn't have unpleasant side effects. In a study of over 1,200 MindBloom clients, over 89% reported improvements in their anxiety and depression after only 2 sessions. So very powerful stuff. As I've said on the podcast openly, my wife has used MindBloom, and ever since she used it, she has said that she isn't depressed. She's still got some anxiety and other things going on, but she just doesn't feel that crushing depression that she felt then, which is incredible, and it's been a big difference in our life. So if you want to check it out, right now, MindBloom is offering our listeners $100 off your first 6-session program when you sign up at mindbloom.com/Duff and use the promo code Duff. So break free from your anxiety and depression with MindBloom. Go to mindbloom.com/Duff and use that promo code Duff for $100 off. Okay, so back to the question here. As I said, I wanted to get into a little bit more of the cognitive, the thinking side of things. So part of treatment for OCD is often recognizing that the world we live in is inherently risky. We can be happy about that. We can be unhappy about that. We're allowed to have whatever feelings we want, but it doesn't stop the universe from being random and sometimes very unfair. So when you take a good look at your situation, a therapist may help you recognize that your attempts at control and your attempts at avoidance aren't actually protecting you. They may actually be harming you in ways that are harder to recognize, right? They may be harming you in psychological ways that are not as clear as, oh, this thing is a contaminant, it's going to make me sick. And no matter what, you can't perfectly protect yourself. So you're using attempts to do so that are not effective. I think that everybody needs to make their own educated choices about what they feel safe doing in this pandemic and in life. But working with a knowledgeable therapist can help you to determine whether you're engaging in compulsive or avoidant behavior versus whether you're making a choice that's based in sound logic. Now, if you have something like an autoimmune disease, or you have a close family member that struggled with a long COVID symptom and you don't want to run into long COVID, I think it's totally reasonable for you to be more careful than most about masking and other precautions. Like, that makes sense, and I wouldn't try to take that away from you. But if I were your therapist, I would be less interested in the specific behaviors that you are or are not engaging in, and more concerned about the beliefs about contamination or the reasoning behind these beliefs that you have. So I would want to dig in there and see what's the reasoning, what is the line that's led you to these behaviors. So I would highly suggest that you find a therapist to work with that specializes in OCD. Again, even if you don't qualify for a diagnosis of OCD, they're going to be qualified to dig in and ask the right questions and get you on track. And they're going to be knowledgeable about the ways that the pandemic has interacted with mental health in other people as well, because you're not going to be the only one of their patients that's experiencing something like this. So I would definitely suggest that, if you go to any of the places that you search for therapists like Psychology Today, you can click on the little box that says OCD. And I would encourage you to go to the profiles and actually find somebody that specifically mentions that they work with people who have OCD, because, some people will say, oh yeah, I work with everything. But there are people that really do this. This is their bread and butter. And I would really suggest you find someone like that. So in my opinion, I think the issue here isn't really the pandemic. This just highlights a broader issue. And I think that there's a lot of work that can be done here to recognize the areas in which avoidance is not really protecting you from danger. And as I said, is possibly hurting you emotionally. Aside from the treatment stuff of working on your behaviors and the thoughts, I also think that just connecting to your values and what you want out of life can also be very impactful. I'm not sure what your situation is, but for some people, it's helpful to think about the kids that they have or that they want to have, the impact that they want to make on the world, the relationships they'd like to build, what they value in life, because risk is inherent in life. The world is not a safe place. We come into this world, and from the first moment we're out there, we're exposed to things. We are running the risk of, not being able to breathe when we're a baby. We run the risk of, having somebody hit us in a car. We run the risk of slipping and falling and partially severing our spine, as is the case with a therapy patient of mine. We have a lot of stuff that could happen to us, and we have to decide what's worth embracing the risk of experiencing the world and what's not. So having your reason for living kind of right there in the center could be very helpful for you. And if you don't feel connected to that, I would suggest doing some work on that front as well, either through therapy, through your own self-reflection and journaling, through reconnecting to things that you've always cared about, or by talking with people. There's a variety of ways to do this, but getting clear on what your values as a person are, I think could be a great thing. So I really hope you can find some relief here. It sounds like you're exhausted and you're feeling held back right now in life and not really living in a way that's satisfying for you. So I hope that you can find some relief. The research on, just let's say that we are looking at contamination OCD, the research on it is very good in terms of treatment rates. So there can be a difference made here. I want to reassure you of that. But it's just going to take that step. So I believe in you. You could do it, and best of luck. Okay, and before we get into our second question, I want to take another quick break to talk about our other sponsor, that is Air Doctor. So I live in America, I live in California, and even though the weather here is very nice, we tend to spend a lot of time indoors. I mean, here I am right now, it's gorgeous outside, it's sunny and 70 degrees Fahrenheit. I should be outside doing stuff. But, I work inside. I'm recording the podcast and all of that. And unfortunately, according to the EPA, the air inside your home may be even more polluted than the air outside your home. And we breathe a lot as humans. We, take in about 3,000 gallons of possibly polluted air a day by volume. And that's a lot. And if you're like me, you have horrendous allergies that are totally going haywire these days. Pollen, pet dander, dust mites, mold, all of that. So what's the solution? I have paired with Air Doctor because they have a really, really, really good air purifier. So good that it's captured the attention of many media outlets, CNN, ABC, Money, and even more. They filter out contaminants and allergens so your lungs don't have to. The filter that's used in Air Doctor has been tested to remove 99.9% of bacteria and viruses. The average pollen size is about 25 microns, and Air Doctor is almost 100% effective in removing things as small as 0.003 microns in size. And it's very powerful enough to circulate the air in a 630 square foot room 4 times per hour. As I mentioned on a previous ad, it's also very quiet enough to use as a, sound machine or in an office if you're, a therapist or a doctor or something of that sort. So it's a really good product. Air Doctor also comes with a no questions asked 30-day money-back guarantee. So if you don't like it, just send it back for a full refund minus the shipping. And if you are interested, you can head over to airdoctorpro.com. Don't forget the pro, airdoctorpro.com, and use the promo code DUFF. And depending on the model, you can get up to 40% off, which is pretty massive. That 40% off can translate to up to $300. So if you want to save up to 40% off and lock in the special offer, go to airdoctor, AIRDOCTOR, pro.com, airdoctorpro.com and use the promo code DUFF. All right, so let's move along to question number 2. It reads, "Hey Duff, my partner and I have been together for 2 years, and he's always been very loving and supportive of me. Ever since we moved in with each other last year, he started crossing my sexual boundaries. At first it was just small stuff, but it kept escalating until one day he raped me. It happened in my sleep, and afterward we spoke about it, and he apologized profusely, saying it was a misunderstanding and it would never happen again. 2 months later, I got blackout drunk, and it happened again. After that, I pushed for us to go to couples counseling, as I had already tried my best to educate him on the importance of consent by watching documentaries together, reading books, etc. I was hoping to feel more understood there, but while the therapist acknowledged that what happened was absolutely not okay, when I explained I would have rather none of it had happened, she responded by saying that it's a learning process for both of us, and that none of this is my boyfriend's fault either because he just struggles to understand boundaries. I agree that it's a learning process, but personally I don't find the concept of consent that confusing. It feels like I'm the one sacrificing my body and emotional well-being for this process while he gets to satisfy his sexual desires, and it feels like everyone is expecting me to be okay with that until he learns better. I love him very much and he seems genuinely sorry about what happened, but everything has been so traumatizing for me that I'm struggling with depression and don't know whether I'm able to just forgive and forget like our therapist is suggesting." So thank you for this question. It's a very vulnerable topic, so I commend you about being brave by bringing this up, even though it seems like you haven't really been supported in the way that you would have liked to be supported so far. So thank you for the trust here. Consent is a term that we hear talked about quite a bit these days, which I think is amazing, but I don't think it's always very well defined when it's brought up on social media, etc. So I'd like to start by talking about consent and what it is before addressing your specific concerns here. Consent is defined as mutual agreement or permission given by all parties involved in a specific situation. That's the broad definition, right? So everybody agreeing or giving permission to do something. And in this case, of course, we're talking about sexual activity, right? So mutual agreement or permission by all parties involved in a sexual situation. That doesn't have to be just, penetrative sex. It could be any sort of sex act or any act in general. Consent is all about respecting each person's autonomy and boundaries and ensuring that everybody who is participating is willing and enthusiastic. So as I mentioned just there, consent needs to be enthusiastic, right? Meaning it's not like a, I guess so, or if you really have to. Enthusiastic, a yes. And it also needs to be informed and done without pressure or manipulation. If somebody is unable to adequately understand a situation due to being under the influence or other limitations like cognitive limitations, they're not able to give consent. Therefore, there is no consent there. Maybe you've heard the term consent is sexy thrown around on social media before or seen it on t-shirts. That's because it is, Consent is not just about avoiding negative behaviors. It's about creating a situation where connection is comfortable and safe. With enthusiastic consent, a lot of exciting things are possible, right? It's a type of boundary, and you draw the boundaries, you kind of put the playing field out there, and then you can play within that playing field. And that's great. That's a wonderful thing, and it can be very sexy. So consent is a way to facilitate that instead of having a bunch of situations where you're not sure what's okay and what's not. So yeah, consent is something that I think at a basic level, it's not difficult to understand, but sometimes people don't recognize really, really what it means. So hopefully this is helpful in that regard. In your situation, you said that there's a pattern of your partner violating your personal boundaries regarding sex. And I agree that that is not acceptable. Within a relationship, I think there can be certainly room for misunderstandings due to communication issues. Maybe you thought you communicated a boundary a certain way, but it just didn't come across as clearly to the other person. But what you're talking about here is a pattern, right? And it's gotten to the point where you don't feel as safe as you would like to feel with your partner. And to me, that's indicative of an issue. That's not just a one-time thing. This is habitual. This is a pattern, and that's something to be concerned about. I will say, as I mentioned, communication is important, and it's important that your boundaries are explicitly stated and that consent is clearly given or withdrawn when possible. Now, there are obviously things where it's not possible to give consent or boundaries when you're asleep or when you're blackout drunk. And as I mentioned, that does not count as consent. If you've ever said anything like, hey, I don't like that, or let's not do that right now, I'm not ready for that, I don't want to be touched in that way, or let's talk about this before we do that, or maybe, but I'm not sure, let's talk about it more. Any of these things, these are all ways of placing boundaries and noting that you do not consent to these activities. Maybe you would like to be able to consent to them in the future, but those sort of statements are saying those are not enthusiastic yeses, right? That is not consent. That is uncertainty. And that's not a license for your partner to try again and again and keep pushing the boundaries until they get what they want. So I'm very, very sorry that you were taken advantage of by your partner and you were in positions where you couldn't provide that consent. I know you care about this person and wanting things to improve. And it is possible that they can, but no progress made in therapy or individually with you guys will take away what happened. And it's important to remember that, right? So you're not being dramatic by holding on to what happened. It's going to be context for your relationship forever. It happened and you can recover from it. You can still have a great relationship. It's possible, but it will always have happened. I think that there are a lot of things that you've done well here. I think it is totally valid to give somebody that, has demonstrated care for you in the past, the benefit of the doubt when it comes to one incident, right? When you talk about what happened in your sleep, you sort of gave them the benefit of the doubt saying, I feel like that was clear, but maybe there's a way that was misunderstood. That can't happen again. So I'm sure you thought it was a wake-up call, like, hey, these type of escalations are not acceptable. This can't be happening. But then it happened again, right? So that was a good first step of trying to communicate about it and be clear. Then it happened again. Then what you did is you tried to say, okay, if you're not getting this from me, let's look at other people. Let's look at, as you said, documentaries or books. Let's read about this. Let's make sure we really, really understand what consent means here. And that didn't work. So now you're going to therapy. So I think that you've done a lot of stuff right. The experience that you had, though, in therapy, so in couples therapy, I think it's an interesting one. And I think I may know why that happened. Your therapist was clear that the violation of boundaries and consent were not acceptable. But when you expressed that it hurt and you wish it just never happened, they didn't jump in to agree. Instead, it seems like they tried to even the playing field and make it more of a mutual issue. I'm not saying whether I agree or not with the therapist's approach here, but I think that the reason could be due to the type of therapy. In many couples therapy modalities, you're taught to see the dysfunction as coming from the couple or the relationship, not one individual or another. So you try to not pathologize one person and align with the other, because that can be tempting, right? When you see something that in your personal opinion, not like as a therapist, but in your personal opinion, seems like one person is doing something bad to the other. And sometimes it could be very clear, right? Where, yeah, you can't really deny that. But there's a temptation to align more closely with one partner and then say the other person has an issue. So as therapists, we try to work to avoid showing that sort of allegiance when we're in a family or couples therapy situation. I think that the therapist here may have made you feel invalidated, or that the situation isn't as serious as it is, by sort of normalizing it and stating that your partner has work to do and so do you. Like, it's a communication issue. It's an understanding of boundaries issue. So I can understand why you might feel bad about that. I think that there is some context that would be important, right? Like if your partner is not neurotypical, if they have something like autism or some sort of other, type of divergence that makes it so that they don't understand these things very well, I could see some gray area here. But, not understanding consent after having it explicitly laid out for you, and then even learning through it through these other ways like books and such, that is allowed to be unacceptable to you. So the therapist issue is one of the reasons that I will often suggest that people who are in couples therapy also go and see individual therapists on their own, so they can have that feedback and empathy from somebody that doesn't have an existing relationship with the other partner. So if that's not happening right now, I would highly consider that. You finding yourself an individual therapist that you can talk to, that can provide you that validation and empathy and really understand your perspective on it without having to play both sides, sort of. Now, you mentioned that this was traumatizing for you, and I'm not sure for you what traumatizing means, but even, if your trauma isn't like in the clinical sense, if you're not having PTSD symptoms, you may still need a significant amount of time and consistency in terms of appropriate behavior and respect from your partner in order to rebuild that trust that has been eroded, right? This is a knockdown, and it's going to take time to rebuild from that. It sounds like it's been a relatively short amount of time in the grand scheme of things. So yeah, that's going to take some time. You aren't doing anything wrong by being unable to sort of forgive and forget, like you mentioned. That would not be a reasonable expectation of you. Your consent was violated, and that's allowed to be very hard. The clinical research out there shows that sexual assault from a partner, violations of consent, these things can have long-lasting effects on an individual and on relationships in a variety of ways. They can shift the power dynamic in the relationship. It can cause emotional impacts like depression, PTSD, as I mentioned, and often difficulties with intimacy are common, right? It's going to be hard to just dive in and have great sex with somebody who you have been sexually abused by in the past. So yeah, since these dynamic changes and the disruption in trust and communication are very common in situations like this, your partner needs to have some patience. It's going to take time for your relationship to recover from this, if it even can. I also want to make it clear that you don't have to make this relationship work out. I would say that moving in with somebody is often the type of activity that reveals concerns or issues that you weren't aware of before that. So when you don't live together, it's a different picture. And when you do move in, maybe some things come out and you are allowed to change your mind about your partner. This doesn't mean that you don't love them or what you've experienced together hasn't been real. Simply that you're allowed to value yourself and have boundaries and deal breakers, especially if you've communicated those repeatedly and they just weren't respected. That is totally valid if you change your mind about the person. If you do want to continue working on this relationship, I highly suggest individual therapy for both of you and a clear plan to work toward establishing trust, reestablishing trust. So there needs to be a recognition that this isn't going to happen spontaneously overnight or even within the course of a week, that it's going to take work, it's going to take consistency. And I think that you could use this as a prompt to work on all facets of your relationship, right? Build trust and intimacy in ways that are not sexual so that hopefully you can feel comfortable exploring sexually with this person again. And in the end, if you're not able to or you're unwilling to be comfortable with him again, that's not your fault. You're not the one who did something wrong here, and it's not on you to be forgiving about all of this. You're not being dramatic. This is something that happened to you, and you've been trying to give this person chances and work it out with them. So in the end, if it doesn't work out, you've done what you can. But I hope that this is helpful to you. Again, I really hope that you can get at least yourself some individual, support through therapy. It would be a great idea. And I really, really, really appreciate your trust in asking this question. So that's the end of the episode, everybody. I hope this was helpful to you. This has been episode 347 of the Hardcore Self-Help Podcast. I am pleased to report that the bee never came back to try to kill me, so I think we're good there. If you'd like the show notes for this episode, go to duffthepsych.com/episode 347. And if you'd like to send me a question for the show, shoot me an email to duffthepsych@gmail.com. Take care of yourselves, and I'll see you for the next episode. Bye.